No, my name is Moses Isokra. This speech is for my professional communication class, and I'm going to be talking about pancreatic cancer. According to the American Cancer Society, a recent estimate that close to about 49,000 male and female will be diagnosed with pancreatic cancer, and about 41,000 of those will die from that disease. Now I'm going to tell you about the purpose of my speech. The purpose of my speech is to tell you about pancreatic cancer. And I'm credible on this issue because I've done some research, and recently I was able to look at some website and some books and read several things to get some knowledge on this subject. So today I'm going to inform you about how pancreatic cancer, what is pancreatic cancer, and I'm going to inform you what are the symptoms, and I'm going to inform you again how it needs to be cured. So let me start with my first subject, which is what is pancreatic cancer. Pancreatic cancer have two tumors types. They are either the endocrine or the exocrine type of cancer. The most common of these is the exocrine. It's formed around the cell, and then about 95% of cases of pancreatic cancer is the exocrine cancer. And there are several research that have been done on this subject and found out that according to the American Cancer Society, about 43,000 people died from this type of cancer in 2012. And in 2010, I mean to say, and in 2000, and about the rate of survival is about 10-to-1 of people. About 2 to 10 people will die from that disease when they are detected. 2 to 1 will die, in about 5 years from when the disease is detected. Now that I've informed you about the symptoms, about the cure, about what pancreatic cancer is, I'm going to now move to tell you what the symptoms are. The symptoms of is hardly to detect pancreatic cancer because of where it's located in the cell, around the cell. So the best way to do this is you're going to find is to look at the weight loss. If you're losing weight, or you can look at jaundice or digestive issues or problems, then you can be able to now say, maybe I have this disease. But the other way is to go to the hospital to do a CT scan and several other radiation and several other ways, blood clot, blood tests, several ways to detect this disease. Now that I've told you about the symptoms, I'm going to move to my final statement, which is how to cure. The best way to cure pancreatic cancer is through surgery. According to doctors John and Dr. Joanne Coleman. In their research, they said the best way to cure this is through surgery, but a lot of doctors do avoid surgery. So another way to cure pancreatic cancer is to do targeted chemotherapy and several other ways like ultrasound, several radiation therapy or pain management, and several other ways, the way they can do that. And Dr. Panckeatic said when this disease, the drug Ambrox is one of the drugs that saves life. It does save people. It gives about 2 months of extended life when this disease is expected. It's according to its New York, a publication it published in the New York Times. Now I'll run into my conclusion. Now I have told you today what is pancreatic cancer. I've also told you what are the symptoms. I've also told you what are the cures. Like I said, pancreatic cancer is a deadly disease, but it can be cured. Thank you for your time and listening.